Unfortunately, as we know, our state was hit by yet another natural disaster the last few days. Not just in Whatcom County, but in Clallam County. We have been just hit so hard recently by these disasters, and yet we have another one. I visited Whatcom County yesterday. I want to thank everyone there for pulling together. I want to thank the leadership of Mayor Perry of Everson and Mayor Christensen of Sumas, the firefighters, the fast water rescue personnel, and all of the neighbors who pitched in during this tough time. They're doing everything from rescuing people in the buckets of front end loaders to doing water rescue. People did amazing things, and we are so sad to have lost one of our citizens, but we have to recognize it could have been much, much worse. But for the really continued act of public spiritedness we saw in Whatcom County. I visited the home of a couple there that essentially had just finished their repairs from their 2020 flood. In fact, it was done by the mayor. And then they get hit again, and their house is essentially uninhabitable now with inches of mud on the bottom and all torn up, the water broke through the front window. The pain these folks are in now is considerable, but they are remarkably resilient, and we're seeing the spirit of that county alive. Clallam County is also experiencing severe impacts which closed state highways within their jurisdiction. The lands of the Lummi Nation, the Makah, the Quileute tribes have also been impacted. The good news is the water has crested. Crews have been working nonstop during the daylight hours to remove debris. And I want to thank our crews who are out there working so hard in the mud. Several closures remain. The State Department of Transportation is prioritizing critical east-west links, of course. They're moving crews and equipment from other areas to that region to help with the removal of debris. Our Washington State Conservation Corps deployed to Skagit County for sandbagging early in the floods, and they remain ready along with the National Guard for debris removal and other tasks as requested by the cities and counties. The Washington Military Department, in connection with other state agencies like the Department of Health and Department of Commerce, have been doing tremendous work delivering needed supplies, fuel to the Makahs, other material to Lummis, and other isolated communities. We thank them for their efforts. Now we're moving to the recovery aspect of this mission, and we are doing preliminary damage assessments to get a full picture of the impacts and the costs of the storm and flood damage. We don't know yet whether that damage will rise to the threshold that will be needed to obtain federal assistance, but we obviously will be very aggressive in pressing our case should we believe we're entitled to that. That's why it's very important for people to keep records of the costs you're incurring for damages or the assessments of your damages in your home or businesses, and provide that information to cities. The cities are being very creative in doing this assessment. They've actually had educators out knocking door to door to help compile this information. It's very important in regard to our ability to obtain federal assistance. This morning I spoke with FEMA Administrator Dana Criswell about that assessment process and the potential for a presidential disaster declaration and the strong consideration we'll need for the individual assistance that we hope to qualify for the federal government if we get the right numbers coming back. We also spoke about finding creative solutions to the housing crisis that families are going to find themselves in. One of the difficulties in Whatcom County is just a lack of housing, period. We're going to have some, I believe, some cash assistance I hope to get shortly up to these families, but even that doesn't solve the problem. We have to actually find housing. So we are investigating now potential short-term shelter and housing options, and our emergency services department is looking at as we speak. These areas are, some of them are geographically isolated, obviously makes this a much more difficult process.
But I'm really an advocate for regional.
People want to help these families. There is a nonprofit set up on that, and obviously we encourage contributions for people who want to help these families. Now, while we focus on recovery, I think it's important to take a stock of what has happened to us in Washington, and it has been dire this last year. We've had a heat dome that has taken the lives of Washingtonians just because of excessive heat. We've had a drought that has reduced our agricultural production. We've had forest fires now that burned hundreds of thousands of acres and created conditions of smoke that was so bad that air in the Methow Valley was the most dangerous air anywhere in the planet for a while last summer. And now we have these very severe floods that are unprecedented. In some places that we'd never seen floods like this in Whatcom County. All these natural disasters spell one thing, and that is the footprint of climate change, which is attacking our state. It's important to realize that for two reasons. One, we're going to have to all work together to make our communities more resilient, to find ways to have our roads that won't be washed out with the increasing level and intensity of floods, to look for ways to help our water supply system, to look for ways to protect our utilities and our sewer and water systems from these floods, to make our systems more resilient. But that is not all we have to do. We have to attack this problem at its source, and its source is carbon pollution. And that's why we all have to buckle down and take some additional steps to fight against that pollution that is causing climate change. We've had some success in Washington state, but we need to have more. The state yet is not meeting its goals for carbon reduction, and I will be asking the legislature this January to take further steps in this existential crisis, against this existential crisis that is so upon us. And here's what I've learned as governor of state of Washington. In Washington state, you can run, but you can't hide from climate change. It's going to hit you in Walla Walla, in the Methow Valley, in Forks, in Sumas. It's everywhere. And that's why I'm going to look forward to the legislature taking strong action this year to continue this effort. Unfortunately, not everyone's got the memo. There are some folks still fighting against our action against climate change, including Tim Eyman, who filed a very questionable lawsuit against our Climate Commitment Act yesterday. I believe trying to go backwards is a direction Washington state should not go in anything, and certainly against this mortal threat to the health and well-being of the state of Washington. So we're going to ask people all join together to go forward, not backwards, when it comes to climate change. Before I take your questions, I just want quick notes about our efforts in Glasgow at the COP26. We had a good story to tell from Washington state, and I was able to lead a group of 68 states and regional governments in a consortium that put forth assurances that we would adopt a range of emission slashing actions to be accomplished by 2030 and beyond. This includes my executive order on getting to zero emission public fleets in the near future. Now, these jurisdictions, I led an effort that got 68 states and provinces together on this. These jurisdictions are quite a force taken together. They represented 470 million people. If this group was a country, it would be the third largest country in the world. The UN calls us subnationals. We actually called ourselves supranationals. And I think that's actually an apt title because we're able to go faster than the national governments. Washington state is able to go faster than the federal government. And we're seeing that across the world. So these local governments really have a critical role to play, in part because the nation states aren't going fast enough, and in part because we realize that we can grow jobs in our community as we're doing in our state in so many different industries, including new batteries, electric buses, the world's first all-electric airplane up in Arlington. We're building our economies big time, and these 68 governors understood that. So that was a good meeting. I was also able to meet with a number of folks on our bilateral relationships. I think that this is going to help us grow our efforts. I met with the environmental minister of Quebec. We discussed the potential of joining efforts on our Climate Commitment Act and our Cap and Invest bill. Met with a number of leaders from Korea, Catalonia, United Kingdom. Good discussion with the First Minister of Scotland, a delightful leader. So it was a good meeting because we were able to raise the ambitions of people, but also join with like-minded governors from around the world. And we had a good story to tell in Washington State. I also note too that this was hosted by the Climate Registry. It's a nonprofit, and they did this while being carbon neutral. They had offsets that they took care of. So at COP, the world did not get all the commitments that we needed, but there was progress. And I'm glad Washington has a good story to tell and more good work to do, both. On the pandemic front, we obviously would like to be optimistic. In the last month, we've had a downward trend, but this thing can continue to spring back at us because we have a very high rate of transmission. The rate of transition, even though it's come down significantly, still remains very high. It remains dramatically higher than it was in the second wave. And so we have to realize that we are not out of the woods in this pandemic. Some other places in the country are seeing actual increases. We've seen a slowing down of the rate of decrease in our cases. We've had now over 9,000 deaths in the state of Washington. Think about that. 9,000 people have lost their lives. And I really hope that people think about that when they think about whether to get a vaccine or not. Because this is a life-saving vaccine, we're still encouraging people to get it. We're pleased that 10 million doses of the COVID vaccine have been administered. The pediatric vaccine is now available, and already about 60,000 of our most precious assets, our kids between 5 and 11, have got the vaccine. But now we have boosters. We've had a good uptake of boosters, and we believe that boosters will be available just in the next couple days to everyone who would otherwise qualify, not just dependent on age. We encourage people in that direction. Boosters are important. They mean the vaccine works because the booster has been shown to increase the antibody activity once that booster gets installed. So we hope people will continue to use the booster. So as we go into Thanksgiving, I'll just mention a couple things I hope we can be thankful for. One, we can be thankful that 5 million Washingtonians are protecting not only themselves, but they're protecting their families and their coworkers and their community. Because those 5 million Washingtonians all have stepped up to the plate to do something that's good for their community, which is to make it safer. Because everybody who gets vaccinated is less likely to transmit this virus. So big thanks to the 5 million Washingtonians that have really shown they're a proud part of the Washington family. But we also want to thank the brilliant people who have given us these life-saving medicines. These things are blessings, and I think we can be thankful for them. A comment on the Osha Rule the Biden administration has put forward. As you know, this requires a vaccine or testing for companies with over 100 employees. The requirement is now undergoing judicial review, and enforcement is pending further judicial decisions. I believe the standard is the right direction for the nation, and but obviously we have to wait for judicial decisions. I know this has caused a little consternation for folks to know exactly what the near future is, but I hope that we will have judicial review and decisions in the near future. We'll be watching those decisions closely. I do want to make clear for folks that at this time, our intention is to retain OSHA's 100 employee threshold and also the option for testing out in lieu of vaccination. So that's the decision we made at this time, except where changes are necessary to align with our state law. So I do believe these new standards are coming, and I hope people think about how to implement them ultimately. Obviously, we're watching the trajectory of this virus. We could have to take more aggressive action if necessary, but right now, that's the policy that we have adopted. I have today General Dougherty, National Guard, and Nick Streuli and Dr. Shah for comments. And I don't know if Dr. Shah, I don't think he's here today. Is Dr. Shah going to make some comments? Is that the plan?
Just for Q&A.
Okay, Dr. Shah, you'll stand by for Q&A.
I'm
And
here.
with that, great, thank you. You may fire when ready, Gridley.
Governor, given that a vast majority of people in the state have received at least one shot and more than 820,000 people have received boosters, what metrics are you looking at beyond the vaccination rate to determine when emergency declarations will no longer be necessary in the state?
Well, they are the same metrics that we've used when we opened up our economy. They're the same metrics we used when we opened our restaurants. They're the same metrics that we've used when we've opened our schools successfully, which we're really happy about. They're the same metrics that we've used when we've opened our sporting events and concerts. It's the same things, and that's a whole host of metrics that go into the fundamental question is, when can we have a situation where we're confident that this pandemic will not spring back on us and overload our medical care delivery system, which is still extremely stressed. So those are, just to name some of them, the epidemiological curve, what the percentage of Washingtonians that are infected, how fast the infection rate is going, what the hospitalization rate is, what the uses of intensive care units are, what the delta is between different areas in the state and which groups are being affected, what the uptake level is for the vaccination of our people, the progress of any remedial medicine, and there is some hope that we will have a pill form antiviral that will help reduce hospitalizations and death, but that certainly does not remove in any way, shape, or form the advisability of getting a vaccine right now, because that's not going to eliminate hospital and death. So all of those things would go into a decision of when it makes sense for the state to continue on the track which we've been on, which is to remove some of these requirements as we've done over the last several months. And I can't tell you when that will be, but I hope it's sooner rather than later. I will tell you this, the one thing I do know, every time somebody gets vaccinated, that day gets closer. And if you want these things to go back to normal, getting a vaccine is the best thing any of us can do, and I hope people do that.
But the rate is already far ahead of that initial goal of 70% that was set. We're at 80+%. And I think it's clear that COVID's going to be with us for a while, even with high vaccination rates. So can you talk a bit more specifically about how the state evolves to deal with something that might be with us long term, and how to be able to continue to increase the vaccination rate and lower cases, but without the necessity for the emergency powers?
Well, if the emergency powers continue to, to get to a position where the infection rate is low enough so we don't have to have any public policy affecting it, we need several things. We need a higher vaccination rate. It would be useful to have the success of a pill-based antiviral to reduce the hospitalization and consequent death rate. A stable medical delivery system that shows its stability. Those things, as they come online, when those things get to a certain point to remove policy actions, that's when we'll know we can remove emergency declarations and state policies. And as I've indicated, the way to get to that point is to increase vaccinations. Now, I'm hopeful we can get to that point. It's unlikely to eliminate the virus from the globe. That's very unlikely. But there is a substantial probability, in my view, that we can get to a place where the vaccination rate is high enough that it reduces the transmission rate low enough where this will no longer threaten our healthcare delivery system from being overwhelmed. And that's our goal.
But the transmission rate, some public health officials are saying it's really not the best metric anymore. To Rachel's point about this becoming something we're going to have to live with. I think about half of states are no longer in a state of emergency, give or take. I think only 10 states have mask mandates. And I think there's probably 5 million Washingtonians out there wondering, well, what's the reward I get for getting vaccinated? And what is that threshold? We need to get to 90, 95%. When can I take off the mask? When do I get my reward?
As I've indicated, we get our reward when you don't get sick tomorrow and die and have a loved one die. That's a pretty good reward. I'm not sure I'm understanding your question to suggest that saving your life is not a reward. I think it's a pretty doggone good reward, and that's what a vaccine does. It makes sure your spouse comes home and doesn't die. That's a heck of a good reward in my book. So I'm not sure I understand your question. A secondary reward is that you have the assurance that you are not, or the likelihood that you're reducing the risk that if you get the virus, you will not infect someone else. Now, virtually everybody I know doesn't want to infect somebody else. That is a reward to know the comfort that you're reducing the risk that you become a vector. That's a reward. Those are two pretty big rewards. Third, when you get the vaccine, you hasten the day when we can remove any of these restrictions, including mask mandates. So those who are uncomfortable with masks, the best way to hasten the day when we can remove them is to get the vaccine. Now, other states have taken other courses. I recognize that. We call those second-class states because Washington State's a first-class state. We're a state that believes we ought to save lives, and we're saving lives. Our fatality rate, some of these other states that are going the course that you've suggested, they've had fatality rates 2 and 3 times higher than ours. 2 or 3 times more people have died because they didn't take the precautions that we have. And many states are now seeing a resurgence of the virus. I think there's 20 or 22 states that are now seeing their numbers go up again. And obviously we're concerned about that as we go inside for winter, and last year when we went inside, we had a resurgence. So I do believe the things we're doing make sense. They're having some success. Our vaccine mandate significantly increased our vaccination rate of our state employees and our healthcare and our educators. And schools are open, states open. These things I think are having a beneficial impact. By the way, I made a crack about second-class states. I retract that. I don't mean any state is a second-class state. But I do believe that what we're doing is a successful effort to save Washingtonians' lives.
Hey, Governor.
I have a question.
Hold on a second, if you may. Dr. Shah wanted to add something.
Yeah, Governor, just a couple of things that I wanted to mention. One is, as to your last point, the national death rate is nearly twice that of the state of Washington. I think that's really important to let people know. And the other is that our ICU occupancy right now remains at just under 90%. Our hospital occupancy is over 90%. And so we want to see sustained low hospital admissions and deaths before we end any of these restrictions. As the governor has mentioned, our biggest concern is that we've just come off our peak of this 5th wave. And the concern that we have is that we will see an uptick. We're already seeing a slowing of that decrease, but we're worried that we will see an uptick. And when you add in flu on top of winter, that is where the concern comes in. And so we continue to look at these numbers very closely every single day. But again, our real concern is just make sure that we do not go backward. Thanks, Governor.
Thank you.
Yes, Governor. Some people have concerns about shots in the arm with the possible arrival of pills. Do people have similar concerns about pills going in through your mouth?
I don't know the answer. I've been stunned at the number of people who have fallen prey to the deceitful information on the internet about the vaccine. I hope that does not happen with an antiviral. I certainly hope that the number of lies about the vaccine don't get spread about the antiviral. I suspect it probably won't, because it was only the vaccine that got tarred by Donald Trump and the whole COVID thing. And this became now a political issue rather than a medical one. I hope so. I think there's a reason to believe that won't happen with an antiviral. I hope that is the case. But I want to reiterate the potential arrival of this antiviral. It would be a huge mistake for a person not to get the vaccine today, thinking, in March or April or May, I could get the antiviral, and you die in the interim. That's a tragedy. And this antiviral, it might have, you've seen maybe it's 50, maybe it's 80. We don't know what percentage reduction in hospitalization, but it's not 100. So this vaccine is still the best game in town to save your life. There's absolutely no question about that.
Governor, a couple questions, different topics. First, redistricting. As you know, the commission didn't finish its task and it's now in the hands of the Supreme Court. Have you had any conversations with or your office contacted by the court seeking resources, financial, or the staff, since they're not, haven't done this before?
No, I have not. My understanding is the court did do this several decades ago, but I haven't had any communication with the court.
And then I wondered, secondly, on climate change, so much was done in this last legislative session, major pieces of legislation. What further action, what strong actions do you plan to ask the legislature to take in 2022?
Well, we're still finalizing our proposals, but we clearly need to increase the efficiency of our buildings and decrease the use of polluting fuels that pollute in heating and cooling our buildings. And we have a couple measures that will accomplish that. We proposed those last year, they were unable to pass. We are making another effort this time. And again, you know, who could not accept the idea after what we've gone through this last year that we need to accelerate our efforts against climate change? I mean, standing talking to the vineyard people whose grapes were injured by smoke, to the people at Sun Mountain Lodge that had to spend $11 million because of the smoke damage of the forest fires, to the people I was talking to in the Methow who literally could not breathe. They were talking to me about trying to get air filters for people in the Methow Valley. They could not breathe. They couldn't go outside, literally, not just kids, but anybody, in a safe basis. Seeing the floods, talking to the people, I was standing in the living room of this totally, you know, thrashed house that these people were so proud of. They had just finished cleaning it up and fixing it from the 2020 flood. And then they get hit, you know, 12 months later by this flood. Who could see and talk to those people and not conclude that we need to do more against this beast? Now that's the emotional side of it. The policy side of it is that the state legislature adopted a standard that required, it promised Washingtonians that we would reduce our climate gases to a certain level, and we're not meeting that requirement. So the legislature needs to step up the plate and meet that requirement, and I need to assist. We also have provisions that will bring to effectuate the ability to make the investments in the Climate Commitment Act. There's a little thing involving energy-intensive trade exposed industries that needs to get fixed so that that can move forward. There's efforts that we can do that have budgetary needs to help people finance electric cars and solar power. We need to help people get access to this technology to help them with the capital costs to do that. The infrastructure bill that passed Congress, we appreciate the president's assistance, and our delegation has money for charging stations, but we need to help get acquisition costs for cars so that, you know, lower income people can get access to electric cars and solar panels. Then there is a suite of some other things that are smaller to do, and we may think of some additional ones. But one way or another, we just have to up our game. It's swallowing us alive.
Governor, going back to the kind of emergency powers and coming out of this session, I think a lot of people maybe feel like they're in limbo right now. They did everything they possibly could, but they don't see the way out. So can you talk about kind of what you're looking at, but can you explain maybe what the next steps are if everything goes well? Is it immediately removing that mask mandate, then allowing large crowds? Can you just talk a bit about some of the next steps?
Well, I haven't, I can't tell you a sequencing, but obviously we'd like to not have requirements on masks, and obviously we'd like to remove mandates for vaccines at some point that are no longer necessary because we have a high enough vaccination rate. So what sequence that would take, I couldn't really tell you. The Department of Health is, or the Board of Health, excuse me, the Board of Health, State Board of Health, is now looking at ways to increase vaccination of our children in schools. They're evaluating that. They have an expert panel that's evaluating the science on this subject. So that's under consideration. We will continue our educational efforts with people. And again, this is a tragedy of two viruses. One is the COVID virus, and one is the virus of lies on the internet. And in tandem, they have exposed about 1.5 million, 2 million Washingtonians to a deadly disease because they've heard things that aren't true on the internet. And as a result, they haven't got the vaccine, many people. That's why I'm glad you're here as professional journalists who don't spread those malicious lies. So continuing the educational part of this is important, and we will continue that effort. The administration OSHA rule, I think, can be very effective in increasing vaccination rates. And we saw our mandate for our state employees for healthcare and education very successful. And we're very pleased by this because it both increased vaccination rates dramatically and it did not result in crippling our services of the services we're providing. And our critics said this is going to crater public services. That did not happen. People stepped up to the plate, got vaccinated, and we've got a lot of people who aren't going to get sick now as a result. So I think that the vaccine mandate through employers can be very, very effective.
Dr. Shah, did you have anything to add to that previous question?
You know, I think I would just maybe redouble Governor's comment here, which is we continue to look at this every day, and there is a regular look at all the different actions that we have taken, the policies that we have made, and really looking at the numbers, both in terms of community cases and hospitalizations. And that's really important for us to continue to see forward progress, and we certainly don't want to see anything go backward. I do not, as Secretary of Health, feel comfortable making a recommendation to the governor right now in terms of rolling back these requirements that we have in place. It is too soon, and we've got too much at stake right now. I would say, in terms of sequencing, the one thing that has been, if you all remember, we were always talking about previously when we were putting mask requirements in place, we did talk about indoor versus outdoor. And I would say that we know that indoor risk is more so than outdoor. So that would be one area to look at over time. But again, right now, my recommendation remains that we need to stay the course given the concern around the holidays upcoming. We know a lot of people are going to be traveling, a lot of people are going to be gathering, and it just doesn't appear to be the right time to move back when we have those uncertainties that are coming up over the next week or 2 weeks or beyond. Thank you.
I have a question for Dr. Shah. I know currently boosters are not required to be considered, for someone to be considered fully vaccinated, but with the expectation that the federal government will approve boosters for everyone shortly, how long do you think it will take before that is going to be required to be considered fully vaccinated?
You mean an additional dose or a booster dose to be fully vaccinated?
Correct.
Well, we haven't,
Yeah.
you're assuming we've made that decision that we're going to have a requirement. We have not made that decision yet, so.
No,
Yeah, that's right. And then from a federal standpoint, there has been some discussion at the federal level. You know, CDC in particular has had some behind the scenes discussions, but we're not hearing anything more formalized than that. I think at this point, it's really primary vaccination, continue to emphasize people getting either their first dose of J&J or the 2 doses of the mRNA vaccines, and then boosters when eligible. And so that is really the focus that remains at the federal level, and certainly we're continuing to be aligned with that. I have not seen anything formal coming from our federal partners about having any changes to how they classify fully vaccinated.
No, and I was just asking your opinion on when you think that might occur, given the concerns about efficacy of the vaccines, hence the reason why we're doing boosters now.
Yeah, you know, that's an interesting question from that standpoint, but I will tell you that there are a number of considerations that are put in place when it's related to that from the federal level. I don't have a good crystal ball on this one. There have been both sides of it about when do you consider somebody fully vaccinated. I know the federal government right now is remaining with the 1 or the 2 doses, depending on which primary vaccination. I do not see that changing soon, and I would think that that would be throughout the end of 2021, and certainly I would surmise probably into some good portion of 2022. But let's see. They may make a decision not to even go to a change of their nomenclature even beyond that.
Listening to some of the questions about, when this will end, one of the difficult things to consider is how pernicious and dangerous this virus is. Austria is essentially shutting down their economy to non-vaccinated people, period. That's how bad it is. It can come back. And some of these communities have seen it go down very rapidly. It has now come back very rapidly. So non-vaccinated people, all you can do is go to the grocery store, essentially. We're not anticipating that. I'm not proposing that. But my point is that you have to realize that whatever this virus is doing today, it can do a different thing tomorrow. And that's why we got to keep our eye on the ball here.
Other questions in the room before we go to the phone?
Governor, on that point, do you envision that the King County requires vaccine verification to go into restaurants? Is that still on the table for a statewide rule?
We're following the situation in King County. We're evaluating it. We haven't made any decisions on that one way or another.
Could you just explain on the testing options under the Biden rule why you're comfortable keeping that in place for the private employers that didn't afford that opportunity for the workers covered by your mandate?
Well, we thought that it was appropriate to, in some effect, honor the federal decision to have consistency with the federal government. And that's generally the direction we're going. We found in our experience that it was not as effective as a total vaccine mandate, in part because the employer, in our case, was providing the vaccine. In the Biden rule, the employer is not required to provide the vaccine. That may end up in a higher vaccination rate as a result of their rule. So we decided to watch their rule and determine how successful it was out of the chute. And we're looking forward to that.
Anybody else in the room?
Okay. Up first, we'll go to Diane Duthweiler with Cairo Radio. Go ahead, Diane.
Hi, can you hear me?
Yes.
Yes.
Okay, thank you. It appears that the breakthrough case rate is going up, and I'm wondering on comments, I'm assuming it's because the vaccine's effectiveness wanes as time goes by. And I'm just wondering, because of that, at what point, is there going to be a point where your vaccine card expires? Like if you were fully vaccinated 8 months ago, at what point might that card expire and no longer be considered valid?
Dr. Shah, you want to address the breakthrough rates?
Yeah, I don't have the breakthrough numbers right in front of me, but I will tell you that we are seeing a slight increase, but not significant increase with breakthroughs. And I think you are rightfully saying one of the concerns that why the federal government is looking at this question about expanding potential boosters is because of the concern around waning immunity. And so over time, if you do not boost this, the primary vaccination, the concern is that you will start to see more people getting infected despite the fact that they received their primary vaccination. And so that is exactly the reason that our federal partners and we alongside them are looking at what the true message is around boosters and how we can encourage people to get boosters right now if it's eligible. But I know they're looking at a broader categorization of that today into tomorrow. So we'll see how that all pans out. I think the key message is that if you do have waning immunity over time, then the booster really prevents you from having a breakthrough infection. And so that is the, for example, Israel experience. And we want to continue to monitor what's happening, not just across our state, across the country, but also globally. And so boosters work. And I would ask all of you to continue to emphasize to the public if they are eligible for boosters. And we went through an exhaustive list yesterday during our Department of Health briefing on who was eligible. We want to make sure that people get their booster. And Governor, if I may, my two kids One just turned 5 2 days ago, and our 7-year-old are going to be going for their pediatric vaccine later this afternoon, and I'm joining them to get my booster. So all 3 boys, in essence, in the family are getting their vaccine. I just think it's so critical that we continue to emphasize boosters, especially as we get into the holiday season.
I'm glad they're listening to their father. We would expect no less. So that's good news. One comment about breakthrough cases. Whatever the situation is, the people who are dying in our hospitals are the unvaccinated, like 90% plus. You're still in the danger zone big time if you're unvaccinated. I want to reiterate the fact that there are some breakthrough cases is hardly a reason not to get vaccinated. It's a reason to get vaccinated.
Up next, we'll go to Daniel Walters with the Inlander. Go ahead, Daniel.
Yeah, thank you. Are we expecting eventually all of the vaccine and their mandates to be lifted, or are there some vaccine mandates you would anticipate being permanent?
Well, as I've said, if and I hope that we will reach this date where the infection rate is low enough and the vaccination rate is high enough and the hospital capacity is high enough and the medical therapeutic situation is good enough, the mandates are not necessary. You know, this isn't fun. We don't do this for frivolous recreational pursuits. We do it because it's saving lives. That's why we have these mandates, and when that is not necessary, they can come off. And I hope we will get there. Again, it depends on how fast people decide to get vaccinated, and we hope that that will accelerate.
Last question comes from Essex Porter with Cairo. Go ahead, Essex.
Yes, Governor, a question for you and a question for Dr. Shah. Governor, when you spoke earlier about federal disaster aid, you spoke very cautiously about whether Washington would qualify for federal disaster aid. But considering what you saw yesterday, is there any doubt that Washington will qualify for federal disaster aid, and how long might it take?
Well, yeah, unfortunately, there is a question. You cannot be assured of this, in part because the federal rules are very amorphous. They're subject to substantial discretion by the administration. The rules aren't entirely clear from a numerical standpoint. So I'm hopeful, but there is no certainty in this regard. But we're going to do our level best to assemble all of the damage so we can make the strongest possible case to the federal government. And we will do that. And I am impressed by the local community's efforts already to assemble that decision. As I indicated, they've taken some of the educators who couldn't be in the classroom the last day or two, and they're going out and helping assemble this damage estimate. So we think the local community is really on it. FEMA is attentive to this. As I indicated, I talked to the FEMA director this morning. And so, you know, they know about the depth of the problem here.
In general,
we'll do the best we can.
General Dougherty, did you have anything to add?
Yeah, thanks. Yeah, actually, the governor's spot on. The rules are pretty fluid at times. You know, for individual assistance, you're talking about 100 or greater homes that have been impacted. But unfortunately, our experience has been that gets interpreted in a host of different ways at the federal government. So the answer really is that we need to do those preliminary damage assessments and add it all up and submit our packet and hope for the best. I'm sure that you know, the damage out there is great. We all empathize and sympathize with that, but we really have to do the math and put the paperwork in.
And we appreciate your troops, General. They've come home from the Mideast and turn around and go to the Macaw Reservation and deliver food and fuel. So thank them for us, please. Pretty hard-working group.
Absolutely will, Governor. In fact, I just got late breaking news. We're preparing a truck convoy to depart here tomorrow morning to deliver water out to Clallam County and over to Neah Bay. So we're looking forward to being able to help there.
Yeah, put it on our work order. We need some snorkels for our trucks too, so we can go a little deeper water. That's something we gotta think about. Before we break up, this is the last question.
Governor, if I might, I had a question for Dr. Shah, because or a week from Thanksgiving. So people are wondering, is it okay to have big gatherings around the Thanksgiving table this year?
Yeah, thanks, Essex. We covered this yesterday as well. So let me just make sure that I'm very clear here. We want to remind everybody that we continue to be in a pandemic, and the safety of those yourself and those around you is paramount. That means be very mindful around both travel as well as gatherings. If you're in a setting where all the people in a small group setting where all the people are vaccinated, that is going to markedly reduce your chance of getting COVID-19. And so I think the big emphasis that we want to make is to make sure people get vaccinated. And I've talked to many people who have said one of the motivations around the holidays for people to, see their family members or their friends is to get vaccinated so that they can safely do so. I would still caution people from large gatherings. I still think we need to be careful with that. We certainly want to make sure people are wearing masks and doing the kinds of things indoors. But the real concern I have is really around travel, because you're going into other communities across the country, other states across the country. A lot of people, obviously there's air travel, but a lot of people aren't mindful of what's happening in those settings when they actually travel. So what we have been advising people is to be very cautious when it comes to in transit, wearing masks, obviously making sure that they get vaccinated in advance. And then certainly if you're going to an international setting, you may even need to be tested. I also know that there are certain people who are saying to even family members, if you have decided not to get vaccinated, we're sorry to see that, but we are going to ask you to get tested before you come into our own home to be at the dinner table. I've heard that as well. And so I think there are a lot of things that people can do. We have a lot of information that we've been putting out on social media as well as on our website, Essex. So I would just remind you to be able to please amplify the voice here. This is a very challenging time. This is very different than last year when the governor and the first lady were doing everything that they needed to do to remind people to stay home and not have gatherings. We're trying to do what we can to remind people how to safely be able to gather and do things, but to do it with safety and protocols in mind. And then the final thing about this is that, look, at the end of the day, this is what concerns us. Flu season is here. Get your flu shot. Do all the things that you can do. Get your kids vaccinated if eligible. And certainly the key message is avoid those crowded or large gatherings, especially indoors, because that's where the risk is the highest.
Thank you.
Before we wrap up, I have a further executive proclamation to issue. This is pursuant to my general executive authority, not the emergency proclamation. As you know, I have the ability to recognize individuals in Washington who are particularly inspiring and have done an extraordinary amount for the Washington community. And when I meet somebody like that, I get to declare them the Washingtonian of the day. And when I do that, I take off my governor's pin and I get to pin it on them. And today I'm going to recognize a Washingtonian of the day, a person who has done an incredibly effective job for 39 years, sharing the truth as he can ascertain it with Washingtonians. Someone who's worked for Cairo, who was one of the first on the Mount St. Helens story, and every single day has helped Washingtonians figure out what's going on in their state. He's a person that, in my mind, epitomizes professionalism in journalism, because you can tell when you talk to this man, he cares about objective truth rather than scoring points on anyone. He tries to look for the best in people. He tries to get the straight scoop, unalloyed with any particular partisan or nonpartisan approach. And he's given confidence to me throughout the years that people will have a real pro on the job of providing true news to Washingtonians. So today, the Washingtonian of the day is Essex Porter. And Essex, I look forward to when I can personally give you this Apple pin, as well as a very inexpensively framed Essex Porter Washingtonian of the day. And we wish you well I have to say that I will miss working with you. You have made me a better governor. You have inspired me with your insights. You have tested me with your questions. And I have never felt for a second that you were unfair to anybody in the state of Washington. That's a heck of an attribute for professional journalism. Round of applause for Essex Porter. I think
Governor, thank you very much for your very kind, your all too kind words. I very much enjoyed covering the news with the people of Washington State in mind, and also very much enjoyed working with the all too small now Capitol Press Corps. They set a very high standard, and I've just tried to keep up. Thank you very, very much.
well, it's sincere what I said, Essex, because I don't have to be nice to you anymore since you're retiring. So I can tell you I meant everything I said. We wish you well.
Thank you.
Everybody, be well. Take care.